incidence of reporting seems to cast doubt or puts a question mark on the previous Bryce type study incidence.
I mean, clearly that was the danger of that, layer of interpretation, or you could say misinterpretation. And we did our best in the launch, in the production, you could say, of the report to avoid or prevent that. What it should have done is clearly stimulated further research for very large-scale studies doing the alternative method, which is a very large-scale Bryce methodology. And in fact, it is there are two recommendations within the report. One is to keep an ongoing registry of patients, however they are captured.
Yeah.
And I think an ideal situation would be that, yes, you take the spontaneous report, put the patients into a registry, but then you have an ongoing Bryce activity that captures more and put them into a registry too. And then within your registry, it's sort of like the US registry, which is entirely passive and voluntary, but a more active registry, that then within it has two cohorts. You have a spontaneous cohort and a Bryce cohort, and actually you can track those over time. And that's embedded in the report as as recommendations.
Yeah.
It's unfortunate that the college has sort of moved on to other things and sort of interest in other things, and that is unfortunate. But I think if we plug away, we hopefully should get that back on the agenda.
I don't want to misinterpret or misjudge him because he's not here to answer himself, but my recollection is that Professor Tim Cook thought that the data cast doubt on the Bryce methodology, and there are some significant questions to ask, such as around, does repeated Bryce questioning cause priming, for example?
I think I wouldn't go so far as to say it cast doubt, and again I don't know if that's his particular view or not, but I think it did bring into focus that the Bryce methodology does itself need further validation.
Sure. I
think it's true to say that it's been accepted somewhat blindly. It hasn't been critically examined. It might be there might be room for improvement within Bryce.
Sure.
So I think there is a concern that we don't fully know what Bryce is eliciting, and whether it's the right way of eliciting whatever it's eliciting.
Sure.
So I think the easiest way to put it, the simplest way to put it, is that Bryce is one extreme, and NAT5 is probably the other extreme, and somewhere in between is. But the problem is it's such a vast gulf.
Well, indeed, yeah, and if my memory serves me correctly, we're talking about on average about 1 in 19,000 with NAT5, and approximately 1 in 600 for Bryce.
That's it. Yeah.
So that's the gulf